Hello and welcome to the Fit to Transform podcast, where you learn how to train and diet effectively and, most importantly, how to maintain those results for life, once and for all. I'm Nikias Tomasiello, a transgender training and nutrition coach working online with anyone who's ready for a true lifestyle transformation, anywhere they may be in the world. As a friendly reminder, any and all information provided is for educational purposes only. You should consult with your doctor before implementing any changes to your diet and exercise program. With that disclaimer out of the way, thank you for being here. Now grab yourself a cup of tea or pre-workouts and enjoy.
Yo, dear listeners, welcome back to the podcast. Today I have a returning guest, Mike Challis, a physiotherapist and bodybuilding coach. Welcome back, Mike.
Hey, thanks for having me, Nikias. Really glad to be back.
And I'm glad to have you back. The last time we spoke, it was in episode 64, where we talked about differences between physiotherapists, chiropractors, and personal trainers, whether it's safe to let the knees go over your toes when you're squatting, and whether it's safe to deadlift with a rounded back. We talked about navigating pain and also dealing with an injury. And this time, I have more questions that come up with my clients that I believe a physiotherapist would be a much better person to ask than me. So I brought them all to you, and we might not be able to cover all of them, but I think that those that we will cover will be very valuable to the listeners.
Absolutely. Yeah, I'm excited to get stuck in.
You very kindly sent me an infographic about back pain before we started this podcast. So I want to start with that topic because I'm sure you also find it in your own practice. A lot of people suffer from what they call chronic back pain. So my first question would be, how do you find that it presents in your clients? What kind of symptoms? What does it feel like to them?
I think it really presents in a lot of different ways because the factors that can cause back pain are many. And so there are many different things that can lead to back pain. And often it's very rarely one thing. It's a combination and an interaction of lots of different things. So the types of movements that I will see, the types of sort of things. So for example, someone might get pain when they've been sitting down for too long, or if they've been driving and it's better with movement, whereas for someone else it might be a different story. And again, the things that have caused it in the first place might be slightly different. So for one person it might have been a one-off acute cause, whereas for someone else it might have been just a gradual worsening over time. So again, it kind of presents slightly differently depending on the person.
So my first takeaway is that it's a very individual experience rather than a one-size-fits-all type of pain.
Absolutely. So that's a key takeaway as well.
Now I'm going to go through the points that the infographic you sent makes because I think they will be really helpful. And so my first question is, if you get persistent back pain, is that dangerous?
No, not at all. And it's very much, I think the most common misconception I think we're having at the moment, or that can be made, is that pain equals damage. And that's not necessarily the case. There's not always a direct correlation or link between pain and a structural cause. And we know that and this kind of ties into another point that the infographic mentioned, which was related to scans. So they've literally done research where they've shown that probably over a third of pain-free 20-year-olds had a disc bulge, which is a little structure in the back which is helps provide a bit of shock absorbency. And it's quite known as disc bulging or slip discs. Probably a lot of people have heard of that. But even in pain-free individuals, if you were to scan them, they could show signs of that, but they could be completely pain-free. So there's not always a link between the structure of a person and whether they're in pain or not. So it's really using it as a guide. And again, like coming back to pain for a moment, there are many things that can lead to pain. So for example, even things such as stress, poor sleep, even those, hormonal changes, like all of those sorts of external things which we wouldn't necessarily think of being related to pain can influence it. And we've all had those situations where maybe we've slept really poorly and we're just really irritable, or we're really stressed and we stub our toe and it feels like the worst pain in the world. you know so all of those things can influence pain, and so many things can impact pain, not just structure. And so it's really important that when people are experiencing pain, that they're not automatically associating that with damage or anything of that nature. We want to listen to it and we don't want to be reckless and just do whatever we want. But at the same time, we don't want to, excessively sort of worry that we're causing damage to our bodies.
So what I'm hearing is that I could be experiencing varying degrees of pain, even if what's happening is the same thing. And maybe I get a heightened level of degree of pain because I'm more stressed and I haven't slept as well. Whereas if I had been sleeping better and had been less stressed, the pain would have been lower, but what's causing it could be the exact same thing. Is that right?
Yes, absolutely. So I think it's just, I guess the takeaway I want the listeners to get from this is that many factors can influence pain, not just the structure of or the tissues as such. And pain can fluctuate from day to day, but that doesn't mean it's getting worse. There could be other things outside of the problem that are influencing that.
That's very interesting. Thank you for explaining that. Now, there are some um, factors that are often considered causes of back pain, and I'm wondering if we could cover whether these factors are real causes or not. And I'm talking about getting older, having poor posture, and having a weak core specifically.
So, so all of those factors. So age, for one, isn't directly related to back pain at all. Um, yeah, and there isn't. Yeah, age doesn't mean that you're relegated to a life of back pain. Equally, posture isn't necessarily related. It can contribute maybe. So again, I think what we're finding though, it's the length of time that we're spending in positions. So even if someone was completely fine, if they spent 8 hours sitting down, they're probably in the same position without moving whatsoever. They're probably going to start to get a little bit uncomfortable. So it's more the length of time that we're spending in those positions versus the actual positions or postures themselves. So I think regularly getting up and moving, and again, that doesn't have to be every 5 minutes, but maybe if you've been sort of sitting down for an hour or so, hey, maybe it's time to change the position slightly, or move around for a little bit, those sorts of things. And then the final one, which core strength. So again, that's not directly related to back pain. Having a weak core, etc. That's not necessarily related to it.
And then some people are concerned that doing strenuous exercise or even activities of daily living could wear one's back out. Is there any truth to that?
No, not at all. So we're very like what we've got to remember is the body is incredibly resilient and incredibly strong. And when we're thinking of intense, vigorous activity, I think it's a case of thinking of like, am I ready for it? So, for example, if someone has never stepped in the gym before, we wouldn't suddenly tell them to squat 100 kilos. We'd want them to gradually build up to it. And it's the same with any activity, whether that's running, whether that's kind of doing any kind of exercise. It's what's appropriate for that individual, and it's probably more a case of, hey, that individual isn't ready for that amount or type of activity, rather than the activity itself being sort of dangerous, damaging, or wrong, so to speak. And I can't remember the other point that you mentioned as well. Sorry, what was it? I think
I was
was there
talking
another?
about the fact that doing strenuous activity, but also activities of daily living could wear
Ah,
one's back out.
so, and again, I think with that, again, there isn't, there are no activities of daily living which are inherently dangerous. I think the things that we consider are more the repetitive nature of activities. So, to use gardening as a common example, it's not necessarily the fact that gardening is bad, but often people will be hunched over for for hours on end. They get lost in weeding, they get lost in the weeds, and and so it's more, again, I think it's more the length of time rather than the actual activities themselves. So it's just, again, it's about being aware, being mindful of the body a little bit, and then just changing those positions, changing those postures as best as one can.
As a bodybuilding coach, I can't help but think, or rather, somebody who's interested in hypertrophy, I can't help but compare this to training in the gym. And it sounds like what you're saying is volume management. So you're managing the length of time that you spend in the same position, and you're managing the length of time you spend doing the same repetitive action. It's a bit like saying, hey, maybe we're not going to be doing 100 reps of this exact exercise for 5 sets. We're going to do 3 sets of 12 to a greater intensity of effort, and that's likely going to be less impactful on the body.
Exactly. It's completely that same approach. But we often don't think about that. We sort of completely think of it in a different way. But that's exactly the case. And it's less bodybuilding example, but hopefully still sort of impactful. Like when it comes to running, people will often go for a run because it's easy to do, and they just think, oh, I'm going to run to get fit, sort of thing, or run to be healthy. Well, in actuality, we need to be fit to run, because there's a lot of impact, there's a lot of forces going through the body when you're running. And again, that's not to say running is bad, but if someone has never run before, we need to build them up to running 5K or whatever the case is. Not kind of, again, we need to gradually increase the volume, increase their tolerance to that load rather than just diving them in straight there.
And staying with the fitness examples, when somebody is very new to the gym, I'm not going to program 12 sets per body part for them. It's going to be, how about we do 2 sets of one exercise for each body part? And then we'll build up from there. Because if I gave them 12 sets, they could do it, but they would probably do it once.
Exactly. It's 100% that. Absolutely.
That is really interesting that in the end, the body always seems to work according to the same principles in different scenarios, but we don't always think of it that way, as you were saying.
No, exactly. And again, like, coming back to the point of, there's no positions that are bad. So if you needed to pick up a shopping bag, you know, it's fine to let your background. You don't have to pick up a shopping bag like a 100-kilogram deadlift or whatever. The body's really, really resilient. But it's just about you know managing things in an appropriate way. Like if you were picking up, you know, a big block of bricks or whatever, yeah, sure, you're probably going to want to treat that a little bit more like a deadlift. But if it's just your average bag of groceries, then you don't need to worry.
That makes a ton of sense, and I think it's also quite reassuring. Now, with regards to potential cures, in the medical world, as far as I'm aware, what's usually offered is injections, drugs, or some kind of surgery, even. And I'm wondering if these have been shown to actually solve the problem, as far as you know.
No. So in the vast majority of cases, these haven't been shown to be helpful at all. And again, it's probably because we're not because pain is very complex, and we're thinking that there's going to be a magic pill or potion that's going to take that pain away, when in reality we're not addressing maybe the underlying root causes that are contributing to that pain. So I think the things that have, really been shown to help is, first we need to understand what's triggering your pain first, and we need to have that multifaceted approach in terms of, right, initially modifying those activities that are contributing to pain, then trying to really identify, okay, what could be causing and contributing to this problem, and then working on addressing those factors. And that's the biggest thing. And sometimes I think also it's it's looking a bit more holistic in the body, because again, there could be something outside of the back that could be influencing the back pain. So for example, someone could have maybe some weakness around the hip or somewhere else, and again, that could be potentially influencing a problem. So maybe when someone's going to do a deadlift, for example, maybe they've got some strength imbalances around the hips or whatever, just as an example, and maybe that's contributing to them using their back a little bit more on the deadlift, and that's giving them a bit of back pain. So it's about thinking a little bit more holistically, and again, having an assessment from a professional and combining that with other factors to try and address the root causes, and still staying active and healthy, because again, a lot of the research is showing that you know, working around the pain, even going for things like walks, etc., staying mobile and active, those can really have a positive impact on pain as well. And like what we talked about, pain up, particularly if you've had persistent pain for a long period of time, it gets you down. And when you can't do the things that you want to do, it can really impact us mentally, which in turn can have a negative impact on our pain. So it's a bit of a vicious circle. So it's really important that we look after our mental well-being, always think about things from what can we do versus what can't we do, so that we're always doing something and we're kind of maintaining that relative sense of well-being, whilst underneath all of that working on improving the problem.
What I'm going to do now is I'm going to try to summarize everything we've talked about, and you tell me if I did a good job or if you have anything to add. So,
Absolutely.
what I learned from you is that everybody's experience of back pain is different, and also of pain in general is different. So, the real treatment, the most evidence based and potentially most effective treatment, is going to be specific to the individual, and it involves, first of all, figuring out what's triggering the pain and modifying these activities, identifying any other causes or contributing factors and addressing them using a mindset of what do we have under our control right now as opposed to what we cannot control. Taking a holistic view where we take into account that it could be that some other parts of the body may be influencing the pain as well. And also, you're saying it's very important to stay active and healthy and be mindful of building up, especially to new activities gradually, and to get up and move regularly, because it sounds like the length of time spent in the same position and the repetitiveness of a certain activity seem to be the main causes of back pain.
I think you've done a fantastic job at summarizing my monologue just a moment ago. What I would maybe just add to that final point is that if someone's experiencing pain when they're walking, don't feel that you need to push through that and you need to, keep walking for an hour. Actually, pace yourself. So, again, find a comfortable position, but then, okay, maybe just kind of go for a walk or stand or be active for maybe sort of 10 minutes or so, and then have a break again, but don't force yourself through discomfort just because you think, oh, walking is good, I have to walk. But if it's causing you pain, don't push through that too much. And it's perfectly acceptable to maybe find a different mode of exercise. So for example, if walking's painful but maybe cycling on a bike feels comfortable, hey, stick with the bike for a little while until we can get you kind of walking a little bit further, and do those sorts of things. So again, it's about being pragmatic, relative to your situation, to one situation, and then moving forwards from there.
Excellent. That was the perfect way to tie a bow on this topic. I think now I'm going to move on to um, two other types of pain, or sometimes they can be referred to as injuries that are quite common and, as far as I understand, often due to repetitive movements. So this would be golfers and tennis elbow. And if you could explain, first of all, the difference between the two, if there is any.
Yeah, so well, both could be thought of as an overload type problem where either things have been done at a loading that's maybe just too much in that one particular instance, or maybe it's just done so repetitively that it's just caused an overload and a sensitization of that area. Now, when we're talking about kind of the classic more tennis elbow, I mean, these are very umbrella terms that are probably not very accurate, because you don't need to be a tennis player to get tennis elbow, obviously, and vice versa. But when we are referencing and speaking about tennis elbow, we're talking about the outside of the elbow, or what we call the lateral aspect of the elbow. And when we're talking about golfer's elbow, and also when we're thinking about tennis elbow, we're thinking about more of the extensors of the wrist versus the flexors. and golfer's elbow is on the inside of the elbow, or the medial aspect of the elbow, and is primarily associated with kind of flexion of the wrist. And there'll be probably different kinds of activities that influencing it. So for example, if you've got tennis elbow, very often that's associated with a lot of wrist extension and, rotation type movements. Whereas again, golfer's elbow might be related to more flexion based kind of movements. So just subtle nuances there in terms of what can be causing it. And again, similarly, it's not always, there can be multiple factors contributing to it. So what we typically see as well is, and it'll be interesting to get your kind of experience with your clients, but the most common example is people who've got manual jobs, or equally maybe people who do a lot of DIY around the house. Maybe they're not used to it, and all of a sudden they've got to renovate a room or renovate a house or do some landscaping in the garden, and they've just all of a sudden done way too much too quickly, sort of thing. But what have you got any had any experience with kind of clients with this sort of problem?
So I have. Before I answer that
Yeah.
question, since this is not a visual medium, and I'm not sure that everybody would understand terms like wrist extension and rotation and wrist flexion, could you give a couple of examples of what that looks like? What's a practical gesture that involves these types of movements for the
Ah,
audience?
yeah, good question. So wrist extension, so you could typically think of that as oh, what would be a typical wrist extension movement? So I'm literally moving my hand right now, thinking of what might be causing it. Um, you could, I mean, maybe thinking of a really practical example, and I don't know how accurate this is, but if you're like hammering like a nail, like maybe there's a certain degree of wrist extension when you're doing that. Whereas with golfer's elbow, if you're kind of screwing something, and that's a little bit more rotation and wrist flexion. Essentially, if you imagine, with if you had your palm facing down to the floor and you kind of brought your hands upwards, so your knuckles towards you, then that would be wrist extension. Whereas when you're trying to move your hand down underneath you, then that's kind of more wrist flexion. And if it helps people who go to the gym, if you imagine wrist curls where you're kind of again curling the dumbbell up towards you, or a wrist extension where you're lifting the weight upwards, so kind of again knuckles upwards towards the body, that would be something more wrist extension related. I don't know if that kind of helps answer that question.
Well, hopefully so. What I was thinking about when I think of wrist extension is carrying a backpack on your slung over your shoulder, so you're holding your arm over the shoulder and you let your hand kind of dangle backwards. That really puts quite a bit of can put a bit of pressure on the wrist and pull it down into an extended position.
That's a nice example.
In any case, in answer to your question, yes, I have had some clients who have dealt with both tennis elbow and golfer's elbow. And if I understand correctly, you're asking what type of activities they were engaging in. Is that correct?
Yes.
So I found that when a client gets really passionate about climbing, they go from bouldering or climbing once a week to now doing it twice per week really quickly. And they do it for an hour. And then they want a resistance training program with back training in it. And I have found that if they don't build up gradually and they don't take into account their volume, resistance training volume, as well as the climbing volume, that can result in these kind of problems.
Mm. So I think that's just a fantastic example of, like you said, volume and loading, where again, rock climbing's a really good example of where it's very easy to forget how much you do. So you get, you're having fun, you're enjoying it, and then before you know it, you've done like 2 or 3 hours of climbing in one go, and you're like, and whoever's done climbing before, it doesn't matter, what you do. It's like your grip is absolutely fatigued at the end. Um, so it's so easy to forget how much we do. And again, swimming is actually another example of this. People think, oh, swimming's great, it's low impact, etc. And then they'll go and do like an hour or 2 hours. And it's like, how many rotations of the shoulder have you done in that 2 hours? And you've never done swimming before. So it's always just being mindful of, you know, okay, right, we need to have a little bit of moderation and discipline here if we're just getting stuck into things. So yeah, that's a really good example.
Yeah, I when a client tells me, "Oh, I'm getting into climbing," now I've got like the climbing radar where I'm like, "Calm down, though,"
Yeah.
because it's happened before. But also to the point that you made about swimming and activities that we don't think about as being potentially too much too soon. I think this again, I'm relating this to resistance training. I tell new clients when you start your week number one, I rather you left the gym thinking that you could have done more because it doesn't matter if you're feeling good in the moment
Mm.
because you could be feeling good in the moment and then the next day you could be cripplingly sore and that's not what we're trying to achieve. So it's better, as you say, to be disciplined and err on the side of caution when you're starting a completely new stimulus. And it sounds like to prevent these kind of issues, you're suggesting the same thing.
Absolutely, yeah. And I kind of have been reflecting on this myself with regards to discipline because, we often associate discipline with, we get up early and we go to the gym and, we do what we have to do, etc. But sometimes discipline means doing less. And exactly what you said there, discipline can mean actually, I'm feeling really good, but rather than doing another set, I'm actually going to stop myself. And that in and of itself is discipline, we're taking moderation. So yeah, I think that's something that I've been reflecting on a lot recently as well.
Oh, you're speaking my language. I have so many thoughts on this because I think that it's very common to want to go to want to go the extra mile, especially when you're starting out, because it's when it's a novelty, it's really exciting, you're motivated, your motivation is probably the highest it will ever be. So it's easy to overdo it at that point. But I also find that in many cases, when you do overdo it, that puts you off, and that's one contributing factor to people not being as consistent as they could be. And also from a personal standpoint, I developed a restrictive eating disorder. And so for me, even now, discipline is telling myself to do less because
Mm.
as you can tell from my experience with developing an eating disorder, or at least a restrictive one, my problem wasn't that I couldn't stick with something, it was that I could stick with it too well and always tell myself I could eat fewer calories and I could do more exercise. And even now, I still have the same inclination, even though I don't have an eating disorder anymore. It's a part of my personality to think of pushing myself as a sign of um, progress, and I am really keen on progress. So I'm learning to understand that progress doesn't mean doing as much as I can until I kill myself. It's doing just enough to move forward so that I can continue to do what I'm doing because it's so much better to do 50 every single day than to do 100 once and then be benched for 6 months.
Exactly, exactly. And the thing that you brought to my head there is what Steve Hall and many other sort of coaches talk about, which is some of the best athletes know when to push and when to pull back, and knowing that difference is a huge strength. So it's about knowing like, hey, do you know what? This is appropriate for me now to kind of push myself a little bit more. So maybe okay, last week I was doing a 2 RAR and it was challenging me. But this week, I know I've got to go to one RAR, and so I know I've got to push myself outside my comfort zone a little bit to try and progress my performance. Versus, oh, actually, do you know what? I'm feeling really good right now, and I've done my allocated number of volume. And do you know what? I really feel like doing another set, and it's like, just leave it here. You know, fight, live to fight another day, kind of thing. And I think it's knowing that difference, which comes with time and experience. I think it's normal to a certain extent. When we're young, to make those mistakes and to know where that line is. But then, with experience and time, hopefully we begin to learn that if we reflect on things.
And if you don't have that experience and time, obviously, dear listener, you hire either me or Mike as your
There
coach
you
and you'll be
go.
sorted.
Exactly. Exactly.
Anyway,
Shameless plug.
let's exactly. I am very shameless. Anyway, so we talked about ways in which we can potentially prevent this from happening. But let's say somebody does get diagnosed with golfer's or tennis elbow, then what's the typical timeline for recovery, and how can you help recovery along if you can?
Mm. So again, timeline for recovery is a bit of a tricky one because it kind of depends on the individual, how long they've had it for. Because I've definitely experienced people who've had it for a very, very long time and they've just been putting up with it until it's just bothered them too much. And I think if someone's had it for a long time, it might take a little bit longer to then recover from it versus maybe there's just been an acute overload where someone's just picked something up that's too heavy and they've gotten pain. So I think in those instances which are very acute, I think if it's managed well, it could probably recover within, a few weeks, a month maybe, whereas versus someone who's had it a long time or maybe managing it is very difficult. So again, if someone's got a very physically labor intensive job, it might be harder to modify some of those factors and so it might take a little bit longer. And so when it comes to management, I alluded to it already. Probably one of the biggest things that we need to do is modify the painful activities. So that's finding things that don't aggravate or make the pain worse. I typically say to people, it doesn't always have to be completely pain free. If it's a 1 out of 10 or kind of a 1 to 3 out of 10 in terms of pain, or it doesn't feel like it's making the pain excessively worse after that activity, then I would probably be inclined to say you're okay to carry on. But if doing that activity it felt notably worse, then I would say, okay, we probably need to find a different movement or something different to tick that box. And then when it's better, we can kind of return to it. Another maybe practical suggestion for people is that particularly for things such as tennis elbow, thinking about levers and biomechanics can sometimes be quite important. So when the elbow is fully straight and extended, there will be more load and there'll be more load going through the elbow. It has to work harder. So actually thinking of activities where that lever arm, where the arm isn't quite as straight. So if I was to think of a gym example, if someone was doing, I don't know, like a cable front raise or a dumbbell front raise or whatever, that might put quite a lot of pressure on the elbow. Whereas if we stuck to a more bent elbow variation, then that might put a little less strain through the elbow itself, and so thereby help it. So really thinking about, okay, and also this is a really good example of experimenting with different grips and different sort of handles, etc., because sometimes that can make a really big difference. So if you've got a very straight handle, then that can put the wrist in a position which can put a lot of strain through the elbow. Whereas if you had more maybe of an EZ bar or maybe just kind of D handles or dumbbells, etc., there might be less strain going through the elbow. So it's really important to find movements and positions that feel comfortable, experiment with different grips and handles, etc., to find out what feels comfortable for that particular person.
Mike, it's great that you brought up so many gym examples because my final question was going to be, would it be safe to train upper body movements around this problem, or would it be better to leave the training until it's resolved?
Oh no, absolutely not. So I think I would definitely encourage people, you can still keep training, but in the first instance, you want to find exercise and movements that feel as comfortable as possible without making the pain worse the next, afterwards or the next day. And then kind of just moving forwards from there. And then what we'd do is we'd probably look to specifically load it in what we'd call like a therapeutic way to then try to increase the capacity of the tendon again so that we can then gradually go back to those previous activities and movements.
Excellent. Now, a question I have is about um, myths. So, when somebody has an issue like that, they can be marketed certain procedures or strategies to cure it. I don't even personally know a lot of them, but it could be some sort of massage, some even massage guns, or sometimes it's acupuncture. Are there any of these strategies that you're aware of that can actually have a positive effect? And are there any that you would be confident saying, "Mm, don't waste your money on that"?
Yeah, I think so. There's a couple of things. So firstly, one type of therapy, which is sometimes used for tennis elbow or golfer's elbow, is something called shockwave therapy, which is just like almost like it's like a vibrating, not a gun, but like it's kind of like a rod which has a vibrating mechanism in it. And kind of the theorized principle is that it's almost like when you exercise, it's creating a bit of disruption in the tendon that's then promoting a sort of regenerative remodeling process. Now, that isn't something which people should immediately go to. It's something where if the problem is very, very persistent and they've been modifying all of their activities, they've been doing the rehabilitation and strengthening work and doing all of those other things, and despite all of that, it's still just kind of niggling away and not making much progress. That's when I would say, okay, this is probably a time to maybe try something like shockwave therapy to see if that can just help move things forwards a little bit. And there has been some research to show that it can be beneficial for those types of conditions. And the other types of things are uh, manual therapy. And again, this is the similar thing where we don't want to rely on it. There's no cure. It's not a cure, but it can, in the right situation and for the right individual, complement those other activities. So it's kind of like it's that sprinkle on the cake. So if someone was like preparing for a bodybuilding competition, you know, peak week isn't gonna, you know, drastically, change their physique. But if they've done all the work leading up to it, then peak week might help, so to speak. So it's the same thing with these other types of things with regards to the elbow. It's that 5 to 10% that might just help improve that recovery if it's not improving beforehand.
So they're not silver bullets or magical fixes, but equally they're not myths. They have some research base as to why they could be beneficial, and they are simply a complementary tools to all the other management strategies we talked through so far.
Exactly. And I think the key thing is that sometimes we kind of rely solely on them and we think, oh, it's if I just do this one thing, it's going to help, when in actuality, no, it's the topping on the cake, like you said.
Excellent. Is there anything about golfers or tennis elbow that I haven't asked that you think it would be important for the audience to know?
Um, I don't think so. The only final thing that I would say is utilizing something like an offloading strap. So people might have seen those straps that you can put around your elbow. And for some people, that might just help it a little bit. So whilst things are quite acute, again, it's not something that we'd want to rely on excessively, but it can help to manage symptoms in the short term. So I would just say, like, don't be afraid of using one. They can be very useful. So yeah, we're in the early stages or kind of in as part of a complementary holistic plan, those types of offloading straps for the elbow can be really beneficial.
Perfect. Thank you very much, Mike. So, as for my next topic, we're going to go in a different direction whereby I want to talk about effective warm up strategies. There are people who swear by certain strategies that I'm going to mention in a second, and some people who tell you straight up, don't waste your time with them. And these strategies are, and I'm specifically talking about warming up, and this time in the context of a resistance training session that's oriented towards hypertrophy to build muscle. And these strategies are stretching, active and passive stretching, foam rolling, and activation drills, such as that banded work with resistance bands that people say help activate a certain muscle. So I can repeat them to you if you forget any of them, but could you go through each and explain whether you think they're valuable or not to add within a warm up routine? And also, to
Absolutely.
begin with, I think it would help if you also clarified what's the goal of an effective warm up.
Mm. So the goal of an effective warm up should be to prepare the individual for the the work that they are about to do. Now, my I would probably say that my perspective on warm ups is quite pragmatic because I think it very much depends on what that person is about to do. So, for example, if we've got someone who is going to be doing something that's is going to be, say, a low repetition exercise, or it's very strength, it's going to demand maximal effort, shall we say, then a warm up is going to be important, because we need to build up to that in order to be able to tolerate and express that power. Whereas some research that I read, which was shared by Brad Schoenfield a little while ago, and it was a study in 2014 by Matthias something, and it just basically showed, it compared people who did kind of warm up ramping sets to people who didn't, and the performance between the two groups wasn't drastically different. And so for sub-maximal training, probably the prior repetitions leading up to that probably serve as a bit of a warm up in and of themselves. So if you're performing a bit more of a hypertrophy workout, and maybe it's more higher repetitions, say maybe in the 15 to 20 repetition mark, we might not, doing an extensive warm up might not necessarily be, if you didn't do an extensive warm up, that wouldn't be detrimental, because some of those prior repetitions might serve as a bit of a warm up anyway. So I think a warm up should be specific to the individual, to the background that they've done the previous day, and what their workout and what their training purpose is. So again, if you've got someone who's maybe being quite active, or maybe they've walked to the gym, okay, well, that's kind of loosened them up a little bit, maybe, but maybe they're feeling a little bit stiff. So maybe and we'll go on to this in a second, they go through a little bit of a dynamic mobility just to get themselves kind of loose. Maybe they do a couple of warm-up sets to get into it, and then go from there. But if you've maybe had someone who's worked in an office for 8 hours, they've then driven to the gym, and then they're going to do like a really strength orientated workout or something, or very ballistic and dynamic, okay, we probably need to do something a bit more extensive to warm and prime the body to get ready for that. So I think it's, again, the message that I want to convey to your listeners is that it's not a black and white thing. It's something that's very context specific to the person and the activity that they're going to do. It's like, don't panic if you haven't done a warm up, but what are you trying to achieve in that session, and then prepare your body appropriately for that. So I hope that's kind of helpful to preface things beforehand.
Absolutely. So now, stretches. Can
Yeah.
you first clarify what's the difference between an active and a passive stretch, and which one could be more valuable, if either, for a warm up?
So an active stretch is when you're actively moving through the movement. So that might be something like leg swings, or maybe some sort of body weight squats, etc. But then a passive stretch is where, or maybe more associated with static stretching, is where either someone's holding the stretch for you, or you're just holding the stretch for a prolonged period of time. Now, there has been some research for a long time now that has shown that static stretching can inhibit the muscle, because essentially, when you're holding a static stretch for a long period of time, you're activating the parasympathetic nervous system of the body, and you're also elongating the muscle quite a little bit, which is probably causing other things which aren't what we need going into a very dynamic training session. But I think what they've also shown is that, depending on how long you're holding it for, so if you were to hold it for like a minute and then immediately jump into a squat, that's definitely not going to help one's performance. But if you were to maybe hold the stretch for maybe 5 seconds, but then do something maybe dynamic after that, then it's probably not going to have a massive detrimental impact on that. And particularly if you're going to be doing maybe some, warm-up sets preceding into that, again, it's probably not going to have a massive detrimental impact. I would say it's probably more, and I think the research supports this, where it's probably a bit more beneficial to do something more active and dynamic rather than static. But like I said, if you were feeling very stiff, very immobile, then by all means, if you wanted to do a little bit of static stretching, that's not going to be detrimental. I wouldn't recommend going very hard and vigorous with the static stretching. It's like, do enough to feel loose, but then I'd probably follow that up with some dynamic movements to then again just get things mobile and sort of prime your body for the actual training session itself.
And thank you for gently correcting me. I keep calling them active and passive. That's another definition of stretches. Of course, we're referring to static and dynamic. I got confused for a moment, and thank you for
That's
that
okay.
and for answering the question. So then, what about foam rolling? First of all, what is it? What it's what is it purported to do, and does it actually do it?
Mm. So foam rolling, I guess, has long been associated with mobility and recovery. And I think back in the day when it originally came out, there was a lot of um, discussions around its effect on tissues and sort of, you know, fascial release and that sort of thing. But I think what probably foam rolling does is it can help provide very short-term changes in muscle flexibility and mobility through just changes in stretch perception, pain pressure thresholds, etc. Um, but again, what we'd probably recommend is that if someone finds foam rolling beneficial for them, maybe they would do maybe 5 minutes of foam rolling combined with a dynamic warm up, and to help get them into the positions that they need to get into. So again, if someone was feeling particularly stiff and they were kind of, maybe squatting into their position, but it was like, oh, this is really, really tough, maybe they might want to do 2 minutes or so of kind of like foam rolling, and that might help just ease them into the movement. But certainly, it's not superior to just doing a regular dynamic warm up. Again, similar to the other things that talked about, it could potentially be complementary if that individual feels that they respond to it. So I think there's also an element of um, how used to foam rolling are they? So if someone has never foam rolled before in their life, they might find it like just torture, and they also like they might not know the technique, and so it just ends up being a waste of time slash maybe even just taking away from what they're trying to achieve. So in that situation, I'd say, do you know what? I wouldn't worry about it. Just, do a kind of more of a generalized warm up, maybe going for a walk, going on the bike, 5 to 10 minutes, and then doing something more dynamic. I'd probably recommend that more for them. Whereas if someone is very accustomed to foam rolling, they like it, they find it helps them, then I'd say, yeah, definitely 2 to 5 minutes, but I wouldn't do much longer than that just to supplement their kind of overall sort of proprietary warm up.
That makes perfect sense. And then to finish off on the topic of warm-ups, what about activation drills? So again, I'm referring to work typically done with resistance bands. It's often marketed to people who want to grow their glutes as a way to activate the glutes prior to actual resistance training. Is there any benefit to that?
I think there's a place for them for sure, but I think it's about knowing where they fit into the overarching program as such. So if someone is either struggling to recruit a particular muscle, like maybe say they have got poor mind muscle connection, or maybe they're trying to improve their movement on a particular exercise, again squatting as an example, then more of those isolated activation based exercises, which like you said typically are going to be higher reps, to activate more what I'd call motor units. So every muscle is obviously made up of tiny little fibers, and all those tiny little fibers are activated by nerves. And so, but what can sometimes happen is sometimes we can perform a movement with only, say, like 50% of that muscle's capacity. Whereas sometimes activation exercises, they increase what we call motor unit recruitment. So rather than the muscle operating at 50% of its capacity, maybe it helps it to kind of like 75 or more. And it's also grooving that brain muscle connection where you're kind of becoming more aware and you've got more perception of that particular muscle. So it can be very good for people who maybe just can't connect with a particular muscle, and it can just help improve that connection a little bit, which also kind of it might just supplement that movement themselves. So if they're struggling with a movement, maybe like a lunge or a squat, it can just help cue certain areas which can help improve that movement pattern to a certain degree. So I think they have their place, but I would say overall, it's not, it shouldn't replace, a main hypertrophy training session. It should be there to supplement it rather than replace it, if that makes sense.
It does, and it's really interesting. I'm learning quite a lot from this myself. And a follow-up question I have to that would be, sometimes I find that people say that they can't connect with a specific muscle or they don't feel a specific muscle working during an exercise. And then they'll be my clients, so I will get the opportunity to see how they're moving, how they're doing the exercise. And I've found that the majority of the time, I correct their form, and all of a sudden, they have never experienced so much stimulus in their life. They literally tell me this is my new favorite exercise, and they never previously been able to get on with it very well. So the question I have for you would be, what would be your first port of call? What I'm suggesting, so working on your form or introducing these activation drills.
I would probably go with form and technique first, and then if they're really struggling, then if you're still you've corrected their technique looks great, and they're still like, "Hey, Nikias, I'm not feeling anything here," then I'd be like, "Okay, we can maybe think of an activation exercise, or in the same light, a pre-fatigue type movement." So that could be where, so say for example, okay, I'm really struggling to feel my hamstrings. Okay, well, maybe we do a leg curl movement first before we go into, a hip hinge movement pattern, or maybe for back, if they're struggling with a lat pull down, maybe we do a couple of pullovers first or something of that nature before we go into a lat pull down or something of that. So I think, again, same thing, activation, pre-fatigue. I think all of those would be secondary to optimizing technique.
Makes perfect sense. I'm also a big fan of pre-fatigue or pre-exhaust, not only to help with mind muscle connection, but also for load management, because typically you can then get a similar amount of stimulus, but then on the following compound lift, you're using less load, which can be better for the joints, overall reduced injury risk, and you're getting a very similar hypertrophic outcome.
Definitely. Absolutely.
So anyway, that covers a lot. So it sounds like, yes, activation drills aren't completely useless, but they should be complementary to your resistance training program, and they shouldn't replace fixing your form first and foremost either.
hmm Absolutely. So it's about always thinking of them as a supplement, as a complementary to what we're trying to achieve. So they can be, again, really useful for a beginner or a kind of a less well trained individual who's still trying to learn the movement patterns, still trying to think about, you know, trying to improve that mind muscle connection. But then maybe as they become more advanced, they become very familiar and they've really developed a well-tuned mind muscle connection. They probably don't need it as much. Maybe they might want to continue it just because it helps them, or it helps just getting them into the groove a little bit, but they probably might not need to rely on it as much. But it has its place, and it's knowing about who's the individual who's the individual in front of us, and what's appropriate for them.
Splendid. Thank you for that. The next topic I want to cover is related in that it's about mobility and flexibility. So these two terms I find, or maybe I'm just ignorant and I'm the one who used to use them interchangeably, but I find are used interchangeably. So first I want to ask you, what's the difference between mobility and flexibility and training for these two fitness components?
So again, that's a really good question because they are used so interchangeably and we just don't know what the difference is. But flexibility is what we'd refer to as the actual length of the muscle. So the passive length of the muscle itself, okay? Whereas mobility is a combination of different components. So we're talking about the strength, coordination of the muscles around a joint combined with and through a particular range of movement combined with the actual length and flexibility of a muscle. Okay, so think of it as flexibility, it's typically one component where it's just the overall passive length of a muscle. But then mobility, it's a combination of lots of different factors, including strength, stability, and coordination to move through a range of movements. So if we think of a holistic example, squat, you need kind of mobility to be able to perform a squat. Whereas if you wanted to say, touch your toes or something of that nature, then that probably is a little bit more flexibility based versus mobility.
And how does the training differ? What kind of exercises do you do to improve your flexibility as opposed to your mobility?
Again, that's a good question. So for mobility, it's a couple of things. So firstly, just performing movements through their full range of movement is going to help to improve mobility in and of itself. And they've done research to show that just performing activities that, the person's activities through their full range of movement is sufficient to maintain, perhaps improve mobility. But then after that, if someone, say again, is trying to do a squat pattern, but they maybe can't go very deep, we'd want to assess, okay, why is that person not able to access that mobility? And typically we'd want to see is, do they have good maybe strength and control around their hips, their midsection, to be able to kind of get into that sufficient mobility? Because if the body doesn't have that strength and control, it's not going to allow them to move through those positions, because it's a, hey, you don't have the strength to do this, I'm not going to trust you with this range of movement. So it's just like, no. But again, it comes back to what we were saying a moment ago, where actually just working on the technique and practicing it first, that is just a really good port of call first. And then from that, if there are then specific things that are jumping out, like, oh, okay, maybe they're shifting to the side quite significantly, or they seem very unbalanced. Okay, maybe that's revealing that they may have some specific strength or coordination issues that need to be addressed to help improve that movement pattern. So it branches off depending on the person in front of us, and that's how you'd want to train mobility, focusing on that technique and movement pattern first. And then if anything is lacking and is limiting those movements and technique, then we go off into, okay, maybe some stability based exercises or activation exercises, etc. And if there was maybe a pure flexibility issue, okay, maybe we work on that a little bit as well. But rarely I find with a mobility based issue, I find that the problem is actually rarely flexibility and actually more of a stability control based issue. I tend to find that tends to be a little bit more common. But then going into flexibility, so if you wanted to improve flexibility, now it's very interesting. So there's many ways which you can do this. So you can do static stretching, which is of course one way to do it. Actually doing loaded movements, whether that be eccentrics or moving through the muscle's lengthened portion, that can be another way. And another way, which is a bit more specific, but there's something called proprioceptive neuromuscular facilitation, or PNF, which is basically where you contract the muscle as hard as you can, and then you move into its lengthened range, or specifically you contract the opposing muscle group and it causes a reflexive relaxation of the target muscle, which then allows you to sink into the stretch a little bit deeper. Now, in terms of static stretching, unfortunately, there hasn't been a lot of long-term studies. The studies that have been done into static stretching have only really lasted between maybe 3 to 6 or 8 weeks, I think. So we can only really glean short-term effects of stretching. And it seems that static stretching can be effective at improving flexibility in the short term, but we don't know what the long-term effects are. And so, but the way that static stretching seems to work is that it's not so much that we're necessarily actually changing the tissues, but we're actually changing the person's tolerance to the stretch. Okay. So if people imagine, if they were to kind of maybe touch their toes or stretch their hamstrings, they might get to a point, they might go, oh, I feel my hamstrings, that's stretching. But then if you were to hold a stretch for maybe 30 seconds, and then you might be able to stretch a little bit further, you're like, oh yeah, I'm a bit better. And we haven't really changed tissues in that amount of time, but we've changed the person's tolerance to the stretch. And so the hypothesis and the theory at the moment is that with static stretching, we're not necessarily altering tissues too much, but we're probably changing the person's perception and threshold at which they feel the stretch, if that makes sense. And
It does. It's so interesting.
and again, so finally, if people wanted to do static stretching, then again, how they choose to do it probably doesn't matter so much. So again, thinking of things in terms of hypertrophy, many roads many roads lead to Rome. Uh, Same with static stretching and improving flexibility. It probably doesn't matter so much the specifics with how you do it, but the total length of time and duration and probably the intensity probably is other things that matter most. So, say like maybe 3 times a week, you're doing a total of 5 minutes 3 times a week. But how you do that total of 5 minutes probably doesn't matter, whether that's like, you know, X amount of X or this, it probably doesn't matter so much.
I see. So if I understand that correctly, you're saying it's the total volume that matters, so the number of times per week and the total duration versus exactly what kind of stretch it is that you're doing.
Correct. Yes.
Okay. And when you say that, you mean also the specific time under stretch is what matters most.
Yeah. So that overall duration that a person is in the lengthened position would make a difference. So I think it probably, if someone held a stretch for 5 minutes or did it for, you know, my math isn't good enough to do this, but like, I don't know, maybe like 3 sets of a minute and a half or a minute and a quarter. Some of the listeners can say, Mike, your maths is terrible. But so what I'm trying to say is like how you do that total amount of time probably doesn't matter so much, but so long as you're hitting the total volume or the total length of time in that lengthened position, that's the thing that matters most.
Okay, that makes perfect sense. Thank you for clarifying that. So in my experience, some people will say that mobility and flexibility training, whichever one they are pushing in that particular piece of content, is necessary and everybody should do it. I'm wondering if you agree with that, or if you could tell me and the listeners under which circumstances it would be ideal or best or appropriate to introduce either type of training, and under which circumstances you might not need to worry about it.
So I think a person has first got to look at what are they doing and what do they want to do. So if their training or if their goals necessitate that, again, easy example, but say they want to squat and they want to get a relatively good depth in the squat position, but they can't do that at the moment, well, then that would probably necessitate mobility training. However, if they can do all of the exercises, all of the types of training, activities, sports, etc., that they love to do and that they want to do, then they probably don't need to do it. And actually, just doing those activities in and of themselves is enough to maintain the mobility that they have. But it always comes back to a needs analysis and assessing what are the demands of that individual. So again, this is where, if a person wanted to start doing gymnastics, okay, well, now we need to start doing some specific mobility and flexibility training to make sure that they've got the sufficient mobility and flexibility to do those gymnastic moves. But if someone has no intentions of being a gymnast, they probably don't need to worry so much about doing a handstand.
So it comes down to a needs analysis. So first of
Correct.
all, what's your goal? And if your goal necessitates that kind of training, then you do it. And if it doesn't, you don't have to do it.
Correct, exactly. So maybe like another example of, if someone, if s- say we've got kind of a middle-aged adult who hasn't really trained before, but they have been an office worker for a long time, and so maybe they've gotten maybe quite stiff through their kind of upper back, or they're just kind of a bit stiff in general and not used to some of the movement patterns one might need in the gym. Well, then probably we would want to incorporate some mobility work and more technique work for them because they haven't developed those sort of traits and qualities, versus maybe, you know a younger, not even if you had the same individual, so a middle-aged individual, but actually they've got a much longer history of training, of exercising, etc., they might not need to do mobility because actually for a long time, for years, they've already been doing those sorts of movements, and so they've already developed the sufficient mobility to do those things.
That makes perfect sense. Now, Mike, before I continue, I have two concerns. First of all, I'm wondering if you have time to continue. I have an extra 10-15 minutes available. And then my second concern would be the last topics I would want to cover would be um, if it's safe to let your heels lift when you're doing exercises like leg pressing, the hack squat, and the pendulum. And and I wanted to talk about butt wink as well. However, if you tell me I don't think in 10-15 minutes we can do justice to these topics, I'd rather leave them for another time. So let me know what you think.
No, firstly, I've got more time available, so I'm definitely happy to continue, and I think we'll see how we go. I think we probably could cover it in the next 10 to 15 minutes because I don't think my answers would be excessively long, so to speak.
Let's try it then. So let's start with the heels. As I've already mentioned what the question is, so you take it from here.
Yeah. So again, I really think I would never say I would never use necessarily the term dangerous when it comes to the heels lifting off because I don't I think it only becomes dangerous when one is really losing their balance and they can't control the weights and the loads that they're using. So that would be the first instance where there's definitely a middle ground where you don't want your heels to come off so much that you've completely lost stability and control of the exercise. And equally, I think it becomes detrimental when you can't put the same amount of force through the exercise. So again, if we were doing something like a leg press, and if your heels were lifting so much that it was actually limiting your ability to perform the movement and to use, you know, the amount of loads that you could perform, then I would say it's probably a bit counterproductive in that instance. However, if your heels were lifting off a little bit, but actually it was giving you, a good range of movement, you weren't getting any pain, it was giving you a great stimulus in the target muscle, then I would say, hey, don't worry about it. So I think there's definitely a middle ground where we always want the stimulus to be on the target muscle. And if you're moving through a range of movement that starts to take it away from that target muscle and starts to take it away from your performance, then we've probably reached the point of diminishing returns and gone a bit too far. And so we need to tail it back a little bit. So that would kind of be my sort of perspective and approach to that sort of thing. But again, if your heels come off, typically for a lot of people, your heel kind of maybe might come off like a centimeter, and in that instance it's not a big deal. And if you feel great when you're doing it, the muscles feel great, etc., then again, I wouldn't worry too much about it. But the main things are we don't want to be losing stability, we don't want to be losing strength, and we don't want to be doing it to the point where actually I just feel this in my knees and not my quads. So yeah, that would be my approach to that.
And to your point about it only really becomes, in quotation marks, dangerous when you're losing your balance. That's why I mentioned specifically the leg press, hack squat, and pendulum squat, because on these machines, and potentially on a Smith machine as well, depending, you are kept in place by the machine itself. Whereas I probably wouldn't let my heels lift if I was doing a barbell back squat with a free weight bar.
Exactly. Yeah, that's a perfect example. And to use like a personal example from me is that I've actually got one ankle that has more mobility than the other. And so when I'm doing leg movements for the side that has slightly less mobility, my heel will come off a little bit compared to my right, but it never causes me an issue. And so again, it's something that I don't need to worry about.
Perfect. And we still have time for the butt wink. And
Yeah.
again, this is not a visual podcast, so maybe the description will be a little bit complex. But if you could explain what that looks like in practice, in case the audience doesn't know, and then if you could cover whether it's something to be concerned about.
Yes. So I'll do my best. So if I guess to try and help the listeners, if you were to put your hands on your hips or kind of hands on your hip bones, pelvis bones, that's your pelvis essentially. And when you're when you're performing a compound leg movement, whether that be a squat, a leg press, or any kind of squat based pattern, when we're talking about a butt wink, it's when your kind of coccyx and your pelvis starts to round underneath you, and so that's what we're kind of terming a butt wink. And I think, correct me if I'm wrong, but I think the thought process is if we're allowing that to happen, then we're potentially putting strain and pressure on the back because the back's going into kind of excessive flexion, etc. And that's thought to be dangerous, but that's not the case. And again, I think the most important thing, again, everyone is built structurally slightly different, and that kind of slight movement is not a bad thing whatsoever. But there is a middle ground. So if we're starting to notice that, do you know what, it's happening to the point where I'm no longer feeling the movement in the target muscle, the quads, but actually like I'm feeling a bit of an ache in my back or whatever, okay, we're probably going a little bit too far here, and we want to find that middle ground. But if like your legs feel great, you know, everything's looking good, but there's just that little bit of a movement at the end range of movement, then it's not something we need to worry about. I would say if that type of movement is happening very early on in the range, again, that could signal like maybe some mobility restrictions that we might want to work on. So again, it's a middle ground of, can we perform the range through sufficient and a stimulative range of movement? Is the target muscle being stimulated to the right degree, and we're not feeling it in places that we don't want to feel it, i.e. joints and, you know, places kind of far away from the target muscle? And if all of those things are green lights and all good, then we don't need to worry. But if you know, if we are having some of those things where like, oh hey, I'm feeling this in my back kind of thing, then okay, or do you know what, I'm only going halfway down and I'm starting to see like, or I'm starting to feel that my butt's tucking under, okay, now we need to kind of take a step back and think about, okay, maybe we need to do some mobility work, etc., or just change how we're positioned in that exercise to make sure that we're addressing those factors.
Fantastic answer. Thank you for that, Mike. And as you were discussing the description of butt wink, I thought of how I would define it, which I find quite funny and might help really nail down what that looks like. Most people know the coccyx as the tailbone, so it would be like tucking your tail underneath you.
Exactly. It's like, yeah, exactly. Correct. Perfect description.
Awesome. We covered absolutely everything that I would have wanted to ask you, which is fantastic. And I'm really, really thankful for your time, Mike.
No, not at all, Nikias. Yeah, we were super productive today, isn't it? Weren't we?
I agree. Is there anything about all of the topics that we've covered that you think you want to reiterate or that you want to add something onto, or something at all that you want to bring up that maybe you realized as we moved on to another topic? Oh, I wish I'd said that. This is your time to add anything you'd like.
I think that's a really good question, and I think the first, my main overarching message I think would be to people is if they're kind of sensing something, whether that be pain or whether that be restriction with an exercise, I would I wouldn't panic in the first instance. I think it's about trying to be really objective in terms of how one approaches their limitations or pain, and also not ignoring it, because whilst some pain does go, like we all obviously, particularly if we're pushing things and overreaching in our mesocycle, sometimes it can be very normal and natural to experience pain. But I would say if pain becomes persistent, so for example, it's not associated with, you know, functionally overreaching, or, you know, maybe it's just persistent, so more than a few days, I wouldn't leave it. I would go to see someone. I would talk with the person's coach, or I'd see kind of like, you know, a health professional, whoever that might be appropriate for, just to kind of evaluate it and assess it. Because I think, you know, you fall into two camps. Some people who are maybe a little bit over anxious about problems, and they might overthink it. But then you've got the other camp where they don't see anybody, and then the problem becomes a massive, massive issue. So again, it's that middle ground between like, okay, don't panic when a pain happens, give it some time, assess whether it's going away, assess kind of patterns surrounding it, and see if there are any clues to that, see if it goes away after maybe a day or so. But if it doesn't, that's a great time to see someone, to get kind of that perspective. And same approach when it comes to an exercise technique or mobility restriction. You know, if you can't do an exercise, okay, why is that? Is that technique related, or is there kind of some mobility or flexibility issues that might need addressing? And then just kind of stepping back, calm head, objective, break it down, and then go from there.
Thank you so much for expanding on that. And now the final question is, where can people connect with you if they want to work with you or learn more about what you do?
Awesome. So like you said at the start, Nikia, so I'm a physiotherapist and coach at Revive Stronger with Steve Hall. So firstly, people can find me. The best place for people to interact with me is on Instagram at Mike Revive Stronger. And so if anybody wanted to ask me any questions or kind of follow me, then they can do that there. Equally, if people wanted to book a consultation, either in a physiotherapist capacity or in a coaching capacity, then they can go to revivestronger.com and they can click on consultations and get in contact with me via there.
Perfect. As always, dear listeners, you will find these links and my own links in the show notes. And in closing, I want to thank you, as always, for tuning in and gifting me and Mike with some of your time today. I want to, again, Mike, thank you for coming on once again. And until next time.
Lastly, if you want to support the podcast and help me reach more people, please leave a 5-star rating or review on any podcast platform that you're using. Thank you very much for listening, and I'll speak to you soon.